Welcome back, mitochondriacs, for another episode of Cancer as a Mitochondrial Metabolic Disease. Today, we are going to be talking about additional strategies we have in our tool bag or tools we have in our tool bag as a way to lower your blood glucose, which ultimately will allow you to lower your GKI or glucose ketone index and will allow you to have the foundational success or the foundational prerequisites for success for employing metabolic therapy. If I would have to say that there is one thing that is the most difficult about employing metabolic therapy, it will be the regulation or the proper regulation of blood glucose. Getting your glucose down to a level below 80 milligrams per deciliter and your GKI less than 2 at minimum, but closer to 1 or even less than 1 is no easy feat. And this is why this part of the series exists, because we've got to get your numbers where they got to go in order to employ these other therapies and for them to be successful. So this is foundational, even though this is not quite as maybe as fun or as sexy as some of the glucose inhibitors or glutamine inhibitors. This is this is paramount that we get right. And there is a large population of folks who, when they get a cancer diagnosis, will have prediabetes, diabetes of some sort, whether it be insulin or non-insulin dependent, as well as just insulin resistance and overweight status that inhibits them from being able to have immediate success at getting their glucose and GKI where they want to be. So the goal will be to give you guys as many tools as possible as a way to help yourself with that. And even though I really do like that sometimes these things are studied in a vacuum to help see really what is the effect of that particular thing and is it useful in adding it in to our tool bag. I think that once the preliminary studies are done on is this effective for lowering blood glucose, A1C, et cetera, fasting, insulin levels, and having multiple pleiotropic effects as well that are beneficial for our purposes of employing metabolic therapy. I think it would be nice to see things be studied in combination as a way to see what we can achieve, what is possible. What is this? How are these things working in synergy? Because it's unlikely that we're going to be eating, some matcha tea or some cacao and get just one flavonoid. We're going to get a whole host of flavonoids or garlic or whatever the food is, that's high in flavonoids that are in a vacuum, right? They're going to be in a package, and it would be really nice to know what the package deal brings to the table in terms of lowering your blood glucoses and ultimately lowering your GKI. So I'm going to start out just talking in general about flavonoids. Okay, so flavonoids reduce the complications in addition to the vital roles as effective supplements for preventing diabetes mellitus by regulating glucose metabolism, lipid profile, liver enzyme activity, and protein kinase inhibitors, PPAR, AMPK, NF-kappa B. And what this is essentially saying is that flavonoids are a whole category of phytochemicals that we have access to in our food, first and foremost, and potentially as supplements as a way to improve our health. And in this case, the series of papers we're looking at is talking about diabetes, blood sugar, body habitus, et cetera, and how it's changed by these flavonoids. And I think that this next graph here really really encapsulates how many different areas, or at least gives gives the view of how many areas that we understand as of right now of how these food substances work or how these flavonoids work, right? So they're involved in a variety of mechanisms of how blood glucose would be lowered or enhanced, uptake of glucose to the places where they need to go. So I'm going to start with the left, and I'm not going to read off every single one of these, but there's ones that are very well known. Quercetin, genistein, naringenin, apigenin, rutin. I mean, luteolin. Many of these are very well known flavonoids, and in this part of the graph, they're talking about how it activates the synthesis of glucose transporters. It's talking about GLUT4 here, but of glucose transporters, and then allows them to actually be translocated to the place where you need to go. So if you can imagine, basically, in order for glucose to get inside of a cell, it needs to go through a transporter. And in order for it to get from the bloodstream inside the cells, it's going to need those transporters. And so therefore, what these phytochemicals or these flavonoids are actually doing is it's upregulating the synthesis or the creation of these transporters, and then it's making sure that they get to the place they're supposed to get on the actual plasma membrane so that glucose can be uptaked to these particular cells. So that's one aspect of how these flavonoids actually work. The other way that it can have effects is actually within the liver itself. Okay, it can block several key enzymes that potentially are related to gluconeogenesis and the regulation of creating your own blood sugar. And then it's going to actually either enhance or inhibit certain key enzymes that allow that sugar to be processed within the liver, such as hexokinase. The next way that some of these flavonoids actually work is through inhibiting the programmed cell death or apoptosis of the pancreatic beta cells. So the pancreatic beta cells are responsible for making insulin. And when those pancreatic beta cells, under the influence of high blood glucose levels, activate are damaged, basically it damages the mitochondria, which leads to cytochrome C, release into the cytoplasm, and then cytochrome C release activates apoptosis. What these flavonoids or several of these flavonoids are doing are they're actually inhibiting the excess apoptosis that's happening within beta cells. What does that effectively do? That effectively allows people to maintain their own endogenous production of insulin. And that's critically important, because one of the understandings that we have about diabetes and prediabetes and so on and so forth is that this high glucose level will damage essentially the beta cells in the pancreas. So the beta cells are putting out as much insulin as they can. But when you have the programmed cell death of these beta cells, then the amount of insulin that you can produce becomes less and less and less. And as a matter of fact, there's a point of likely no return with diabetes where you're insulin dependent. And if you've been on insulin for a long period of time, it's possible that you may never, ever be able to get off of insulin. I personally believe that there can be regeneration of those tissues, but the bottom line is that is something that happens that we know about. And so therefore, if we can stop the excess apoptosis of the insulin producing cells, the beta cells within the pancreas, that can help us stave off being an insulin dependent diabetic for longer periods of time, and even potentially reverse your need for insulin exogenously through subcutaneous injections. The PPARs are going to help activate these PPAR gamma to improve glucose uptake through increasing certain genes. And that also is blocked by high blood glucose levels. So these are going to help reduce that, so that therefore these PPARs can be further expressed, and that can kind of snowball into better glucose uptake at the cellular level. they're going to have effects on AMPK, which is a nutrient sensor. And when AMPK is suppressed, we've talked about AMPK throughout several videos as being important for the regulation of mitochondrial biogenesis, mitophagy, the importance of how it affects the mitochondrial dynamics, whether it kind of errors on being the mitochondrial fission versus a fusion, and that can make mitochondria more or less efficient depending on how that balance is going. And then when AMPK is suppressed, that also can drive the Warburg metabolism through pseudohypoxia. So some of these things are able to activate the AMPK pathways, which further kind of puts us into a metabolic state that is of good health. It would be a little bit reductionist to just say it does one thing. It does a whole host of things, some of which are important outside of cancer, and some of those important within cancer, and vice versa. So AMPK activation. Then there are certain tyrosine kinases that can inhibit, that are kind of activated by high blood glucose levels. Some of those things like EGFR and VGF, vascular endothelial growth factors, those kind of things are activated by high blood glucoses, which is why they're not favorable in cancer. And as a matter of fact, just to reiterate, one of the big reasons, at least in one of the C-free papers that I've read, is that one of the reasons why they believe the ketogenic diet or a therapeutic ketogenic diet is effective is because it essentially lowers blood glucose, yes, but maybe more importantly, it lowers insulin and a lot of these cancer-related signaling pathways that are activated when you have hyperglycemia or high blood glucose. So part of the job of these flavonoids is going to be to reverse course there too. And then lastly, NF-kappa B, or nuclear factor kappa beta, is one of the most powerful kind of activators of the immune response and the inflammation, I should say, the inflammatory response. And high blood glucose can activate that. And nuclear factor kappa beta, in addition to providing the excess inflammation that we do not want to have, which can drive cancer by itself, nuclear factor kappa beta can also stimulate or stabilize hypoxia-inducible factor, which is known to lead to a majority of the metabolic reprogramming that happens within cancer. So I do believe that this graphic in particular is, it's showing the diverse actions of these flavonoids. And, I think that it makes me think, about some of the dietary strategies that people have these days. I am at this point, although you may consider, being on a therapeutic ketogenic diet, although I don't see it for the rest of your life, I see it for a period of time to accomplish a specific therapeutic strategy. But you may think of a therapeutic ketogenic diet as extreme. But what I would say is that I don't really want to be known as being on the extremes of either side of one particular aspect of eating. And that is either like carnivore, where you are only animal products and only, meat, and you're not doing any plants, right? I think that extreme, there's benefits to it. There's no question for a period of time. But I do believe that you're missing out on a ton of these, which are from plants. These flavonoids, for the most part, are from plants, and you're missing out on those. And I think that's too bad. That's a downside to the diet. That being said, I also don't think the other extreme of being a vegan is a good idea. I've done that myself before for several years, and it did not have a positive effect overall on my health. Although I think there's good things from it, like these flavonoids, for example, and other things. So again, it's not about like throwing the baby out with the bathwater. It's there. You can pick and choose certain really good things about very particular diets that are beneficial, that can help achieve your health goals. And I think that a more balanced approach is really important for cancer in particular. And I think that there's one thing that, most health enthusiast, whatever your camp is, whether it be paleo or carnivore or vegan or vegetarian or whatnot, is that we want to get our food from whole foods. We don't want to be eating processed foods. And with that, I'll digress. So, going further into flavonoids and how important they are. So we've seen in this past, in this past slide, multiple mechanisms, but there are other mechanisms that we will discuss here that are not even talked about within those mechanisms. So this paper is titled "Clinical Applications and Mechanism Insights of Natural Flavonoids Against Type 2 Diabetes Mellitus," and it says here that self-management poses a significant challenge, but natural sources have shown great potential in providing effective glucose-reducing solutions. Flavonoids, a class of bioactive substances found in natural sources, including medicinal plants, have emerged as promising candidates in this regard. Several flavonoids, including apigenin, arbutin, catechins, cyanidin, have demonstrated remarkable anti-diabetic properties. The clinical effectiveness of these flavonoids is linked to the potential to decrease blood glucose concentration and increase insulin concentration, thus the regulation of certain metabolic pathways such as glycolysis and gluconeogenesis has also been demonstrated. And I'm just going to stop here for a minute and just say, there could be some confusing things, in particular towards the end of this narrative here. So our goal is to decrease overall. Okay. Our goal is to decrease blood glucose, okay, to a safe level, to a healthy level, to a level that's therapeutic for our purposes. But also we want to lower insulin. And it says here that it's going to increase insulin concentration. And I'm just going to try to narrate for what I believe they're trying to say. So one of the issues with diabetics is that there is a gradual decrease in beta cell function, or the pancreatic cells that make insulin. And that is going to be decreased over time. Okay. So what we're trying to do is stop that. So when there's beta cells that are decreased, the insulin levels are going to decrease. And then we're going to have to rely on medications to kind of stimulate the pancreatic beta cells to overproduce insulin, the ones that are still left, and that can burn them out actually, or to give exogenous insulin, right? Which is not what we want. So what this is saying is it's basically protecting the beta cells so they're able to produce insulin in better concentrations when needed and lower blood glucose effectively. So the system is overall working better. So the first flavonoid that I'd like to talk about today is called Gymnema sylvestre. And it is, if you were to probably look at most blood sugar support formulas on the market, whatever the brand is, it's likely going to have this particular chemical in it. And this chemical is a plant included in this family of plants, and it is located in many regions of Asia, Africa, and Australia. This plant is widely used as a traditional therapy for different purposes. Even now, it is being used as a dietary supplement due to its numerous therapeutic uses. It is known to have blood glucose lowering potential and thus is widely used in traditional and Ayurvedic systems of medicine. It renders glucose lowering activity due to the presence of phytochemicals such as guaninic acid, as well as these guaminosaponins. And it is known to have antioxidant, antibiotic, anti-inflammatory, antiviral, gastro, and hepatoprotective properties, anti-cancer, and lower lipid lowering activities as well. And basically what is shown in this paper, or talked about in this paper, is kind of shown in this graphic even more effectively because it shows the diverse actions. First of all, when we look at a certain plant, so in this case, Gymnema sylvestre, it is going to have dozens of active ingredients, right? There's going to be triterpenes and saponins and sterols and et cetera, et cetera, et cetera. And they're going to have a variety of effects. And although, of course, I'm interested in, for example, the anti-tumor activities or cytotoxic activities, the anti-cancer activities, Today, I'm going to focus on its potential to affect blood glucose because that is in line with our anti-cancer approach, right? That's our metabolic approach to lowering the available glucose to these cancer cells. So that's how we're going to be looking at this, and in particular with its kind of mechanisms of action of how it affects glucose in particular. It's going to help prevent the absorption of glucose in the blood, okay, reducing blood sugar. It's going to block sugar receptors in the intestines to prevent absorption of sugar by the intestine, which is going to reduce the blood sugar level because less is going to get absorbed. And then it's going to help in regenerating insulin and beta cells. So, again, it's believed by conventional medicine that once these beta cells are dead, essentially, they're damaged beyond repair and destroyed through necrosis or through excess apoptosis, like we saw on one of the first slides. It helps in regenerating those beta cells. So again, this is where we show that natural medicine is far superior to anything out of big pharma because it has multiple effects which are beneficial on the particular goal we have. It's going to have other effects about goals that we may not even know we want to achieve. And it's going to have multiple mechanisms of action of how they achieve the goal we want. And then it's going to actually have regenerative properties, which is pretty fascinating or pretty unbelievable. So I thought it was interesting to pull out some of this stuff from the paper. So when I was talking about its anti-diabetic activity, because this paper is talking about kind of this plant as a whole, right? But when I pulled out some of the things it was talking about for anti-diabetic activity, I thought this was critically important to share. So, for example, it talks about an ethanol or an alcohol extract. So when we talk about like extracts of these phytochemicals, you'll see sometimes they're alcohol extracted or hot water extracted, or sometimes other ways of extracting them. And so in this case, they're using an ethanol or an alcohol extraction, and it showed that that type of extraction was able to lower blood glucose by somewhere around 46%, which I think is remarkable. And then the water extract of reduced glucose by 26%, and then methanol, another type of alcohol, only had an effect of 12%. So this is where it gets a little dicey because it's like, okay, not only do I know this thing works, but also how it's extracted matters, right? So it just adds a little bit of a layer of complexity to it. And I would say here, I cut this out as well, that concerning the use of Gymnema sylvestre as a dietary supplement in Europe, it says that the levels that, or the amounts that have been shown to have the normalizing effects on blood glucose is in the area of 400 to 800 milligrams of the actual extract, and then which equals an equivalent of 100 to 200 milligrams of this chymenic acid, which is probably one of the chemicals that are in this this plant as a whole, right? So getting down into its clinical effectiveness when looked at in studies, I'm going to start with this one, even though it's a newer publication. It doesn't actually give the actual values, which annoys me, but it is what it is. So it says all studies conducted in adults that used a GC supplement, or and that's the way they're. Give me one second. It looks like they meant to say GS, which is kind of confusing. But anyway, so I meant to say GS, which is the acronym for Gymnema sylvestre. So anybody who's using any study, all studies, I should say, that use this GS supplement for greater than 1 week, they assess the risk factors, and the GS supplementation significantly decreased triglycerides, total cholesterol, total LDL or lipoprotein, low density lipoprotein, and fasting blood glucose, as well as diastolic blood pressure. So again, you may be trying to employ this supplement into your regimen specifically for blood glucose, but it's going to have pleiotropic effects that you maybe didn't want to be part, maybe you didn't expect, maybe is a better way to say it, as the benefits that you're going to get. Now, this paper that was published in 2021, slightly older than this, actually gives us some information that is more helpful. So in particular, it showed that there was a A1C drop when using 300 milligrams twice per day, okay, they saw an A1C drop by 0.4%, okay, which is significant. 0.4% is pretty significant. Basically half a point of A1C is good. Now, again, would I stop here? Would I say, oh, I'm only going to take out, this Gymnema and say no? I would want to combine it with other things that are safe, that are in line with that goal. But still, if you can get a 0.4% drop from one thing, that's pretty cool. And again, most of these supplement companies will add this as with a whole host of other things that we know have effects to have kind of a more maximal effect. So 0.4%. At the end of the studies, at the end of the intervention, 46.7% of the folks had obtained normal values in A1C, which means it completely normalized their A1C, which is pretty unbelievable. The next competitor on the blood glucose lowering game show here is going to be curcumin. And I mean, curcumin, it's got to be one of the most unbelievable plant chemicals known to humanity at this point. And I think we're just still scratching the surface of what these things can actually do. But this particular paper was really talking about curcumin's effects on cardiometabolic health as a whole. And in particular, this paper is titled Curcumin, a polyphenolic curcuminoid with its protective effects and molecular mechanisms in diabetes and diabetic cardiomyopathies. And what it says here is that curcumin, as the most active compound derived from the root of turmeric, exhibits strong anti-inflammation, antioxidant, and anti-apoptosis properties. Recently, clinical trials and preclinical studies have shown that curcumin exerts protective effects on a variety of diseases, including diabetes and its cardiovascular complications. And looking at this graphic, starting at the top left here at A, we're seeing protective effect against diabetes and diabetic cardiomyopathy. And it says decreasing the incidence of diabetes mellitus type 2, decreasing atherosclerosis incidence in patients with type 2 diabetes mellitus. And it has a whole host of things that it affects: triglycerides, total cholesterol, LDL, lipoprotein little a, leptin, uric acid, HDL-C, adiponectin, HOMA-IR, C-peptide, visceral, and total body fat. So it's pleiotropic. It has multiple effects within that one system. It doesn't just affect one thing, right? And then going down further, it's talking about its anti-inflammatory effects. It has effects on a whole range of cytokines: tumor necrosis factor alpha, IL-6, IL-1 beta, TGF beta, as well as, it says here later, decreased glucose and A1C. Then on part C here, or section C, it's going to affect the NADP/NADPH ratio. It's going to basically help with redox balancing within normal cells that allow them to protect against oxidative stress. Funny enough, it has an absolute opposite effect within cancer. It'll actually increase the ability of antioxidant or of oxidants to enhance ferroptosis. But I'll digress on that as well. So it also has anti-apoptotic effects within normal cells to help protect against worsening diabetic cardiomyopathies. And again, within cancer cells, it has an absolutely opposite effect. It will actually have pro-apoptotic effects to help allow cancer cells to die through apoptosis. So going down further, turmeric and its bioactive constituents trigger cell signaling mechanisms that protect against diabetes and cardiovascular diseases. While the chemical composition of turmeric is complex, curcuminoids and essential oils are known as two major groups that display bioactive properties. Curcumin, the most predominant curcuminoid, can modulate several cell signaling pathways involved in the etiology or the cause and the mechanisms or pathogenesis of cardiovascular disease, type 2 diabetes mellitus, and related morbidities. Lesser bioactivities have been reported from other curcuminoids and essential oils. So again, a lot of times we think of turmeric and curcumin as being one and the same. And really, curcumin is just being the most abundant bioactive component of turmeric. Turmeric has a whole host of other curcuminoids and other things that have biologic effects. It's just that curcumin being the most dominant and probably the most studied. That's why it gets the attraction or the kind of the press, right? So this is a pretty neat slide, and it's showing that either curcumin is having a direct effect here. Let me move this quickly out of the way so I can see exactly what it's saying. It's either going to have a direct promoting effect by curcumin, a direct inhibitory effect by curcumin, a promoting effect or inhibitory effect. So it probably is just very strong at certain things and has weaker effects at other things, right? So let's see if we can walk through this slide here. So it's going to effectively promote insulin receptor function. Okay, it's going to strongly inhibit oxidative stress and endoplasmic reticulum stress that's affected by high blood glucose levels. It's going to have effects on increasing the amount of insulin that is released by these pancreatic beta cells. This is a pancreatic beta cell. And it's going to have improvements at the level of the TCA cycle and the metabolic or the mitochondrial electron transport chain of the metabolism of glucose. Okay. And it's going to also, in addition to that, if that wasn't enough, it's going to actually uptake or enhance the production at the level of the nucleus of these glucose transporters. And this particular cell type is GLUT2, and then it's going to allow them to be translocated to the nucleus or to the plasma membrane, so more glucose can be uptaked from the blood itself, right? And although this is particularly talking about a pancreatic beta cell in particular, it's going to have very similar effects on non-insulin producing cells through other different types of glucose transporters, through enhancing mitochondrial function, through insulin signaling as well as protecting against oxidative stress that's caused by high blood glucose. So it is a full service agent here of allowing for blood glucose to go down and for the performance of these beta cells to increase so they can produce the insulin that's necessary, not excess, but necessary. And hopefully with lower blood glucose, we'll need less of that, right? And that's kind of the beauty behind a ketogenic diet is lower blood glucose, lower insulin. So what happens when we study curcumin, turmeric supplement, as a supplement, and what kind of effects does it have on our hemoglobin A1C, which is probably the best way to look at these substances. Now, does a lower fasting blood glucose show us effects as well? Yes, it does. But the A1C is an average of a lowered blood glucose over a 3-month period at least. So therefore, it's just a better global way of looking at the effects of these compounds. So that's why I try to highlight that as being the most important kind of finding from these studies. And this study from 2023 is titled Effects of Curcumin Turmeric Supplementation on Glycemic Indices in Adults, a Grade Assessed Systemic Review and Dose Response Meta-Analysis of Randomized Controlled Trials. And it looks like they used 4,182 articles, pretty unbelievable, and 59 randomized controlled trials were selected from that initial search and those articles that were found. And it says that our findings suggested that turmeric or curcumin supplementation was significantly effective in improving fasting blood sugar, fasting insulin levels. So there you go. It improves fasting insulin levels, as well as hemoglobin A1C, which is where I'm going to focus at most of these papers. I'm going to try to refocus on. In this particular meta-analysis of 23 and 23, it showed a 0.32% drop in hemoglobin A1C. And this particular meta-analysis, an updated meta-analysis from 2024, it showed a drop of A1C of 0.44%. So that's pretty remarkable. And on top of that, it showed a significant drop in insulin as well, because as blood glucose drops, insulin is not as required, right? Because it's not trying to bring that blood glucose into the cells. So therefore, we'll have a systematic improvement in beta cell function, which means more insulin can be released from those beta cells if needed. Okay, if the blood sugar is high enough, and more insulin can be released endogenously by the pancreas. But because it's lowering blood glucose, the overall amount of insulin needed is lower, and therefore fasting insulin levels are going to be significantly lower as well, which is going to have direct effects on cancer in particular. Before I go into the last phytonutrient that I would like to talk about today. Let me see if I can go through some of these. So, good morning to everyone who said good morning. Are apple pectin and citrus pectin supplements flavonoids? What are the carbohydrate loads? So, apple pectin. Um, Yeah, so pectin is likely one of the chemicals that are. It's I believe it's more of a like a glycosaminoglycan. It's not so much a flavonoid, and then citrus pectin supplements. Yeah, I don't. They are going to be two separate things for those, and they're going to have separate jobs. As a matter of fact, we use. There's probably multiple benefits. I can't propose to be an expert on citrus pectin or modified citrus pectin, but what I could say is that we use those, within functional medicine as a binding agent for the detoxification as a detoxifier. So it's kind of more of like a fiber like compound that can help detoxify us through the gut, right? And from what I understand about pectins and other kind of soluble and insoluble fibers is that they don't get absorbed by our system because we don't have the right machinery to break those compounds down. Therefore, they would not have an effective carbohydrate or a glycemic load because they're not acting as a carbohydrate truly. Even though they are a carbohydrate, they're not a type of carbohydrate we can absorb. So therefore, they won't have a carbohydrate load. That being said, even though that's theoretical, what I would say is I would check it with my glucose meter. If you're taking things like that, check with my glucose meter, check with my GKI, make sure it's not affecting me. What my gut tells me about those is because they act as fibers, I would say that they probably will have a glucose lowering effect. As we'll see, I'm going to do a whole kind of or I'll do a whole video at least on fiber and probably like a fiber slash probiotics for, and maybe even a postbiotics for blood glucose as part of this little series to give you guys as many tools as possible. And what I'd say is that you're going to see that it lowers blood glucose significantly. So my gut tells me that, but I have not studied pectin or citrus pectin particularly for its effect to lower blood glucose. But that's what I've seen looking at just fiber in general. IP6, which are considered anti-cancer flavonoids. IP6, I think inositol is actually kind of like a pseudo B vitamin. It may be considered a flavonoid. I'm not sure. I have to look that up actually. Saw a tweet this morning from a doctor who refused to a study where 10 body squats every 45 minutes, every 8 hours per day affects glucose. I believe that. I've seen where like minimal amounts, it's hard to find the studies to back it up, but definitely like very small amounts of like walking or body weight squats, like this person's talking about, or push-ups or whatever you're doing. Even short amount of time can have profound effects on blood glucose acutely. And so, one of the biggest strategies that I employ within my clients is I want them to, for example, I want them to walk outside, ideally in the sun, for like 10 minutes before a meal as a way to help mitigate the blood glucose spikes to any meal that you're eating and to maintain your blood glucose lower and to improve your GKI on average, right? Now, the biohack for that, which I do not believe is as good as walking outside in the sun, just to be very fair, but I think it's going to be a pretty good secondary kind of biohack would be to walk on a treadmill, do rebounding, whatever the activity you want to do for 10 minutes, but then do it in front of red light. So you get the effects of the red and infrared, which by itself can lower blood glucose acutely. But when you start to combine these things with exercise before a meal or even before and after a meal, if you're really having trouble with your blood glucose, maybe before and after a meal, both as a way to improve. So I do think that those are really powerful interventions. And I think those are like first line interventions, really. These can be secondary additions. Now, some of these things like curcumin and quercetin and other things we'll be talking about throughout this series about flavonoids have direct like glucose uptake and utilization inhibition or direct glutamine uptake and utilization inhibition. So therefore, like they're already kind of part of the program. So we're just getting these blood glucose lowering effects as kind of side benefits, which are directly enhancing our metabolic approach. Let's see here. Thank you. Yep. Excellent discussion. Do you have a preference of form of curcumin, as in with Peperine, Mariva? Yeah. So I think it probably. This is where I think I'd like to take this conversation for a second. So as you'll see, in some of the mechanism of action of how these things work, it depends on it not getting absorbed by the GI tract, allowing those chemicals to get into the colon and then subsequently affecting the gut microbiome, which then has the effect of lowering inflammation, oxidative stress, uh, cancer-related signaling, blood glucose, et cetera, right? So the question is, do we want all of these substances to be absorbed? And is part of their magic the fact that they're not highly absorbed? That's a question I'd ask you when I ask about, the preference of curcumin, because what we're talking about is getting the maximum amount of curcumin into the bloodstream. And I do think there's a huge benefit of getting curcumin into the bloodstream, which is why I think that IV formulations of some of these things could be really good. There is IV curcumin already, but imagine IV quercetin or IV EGCG or some of these other things that are like unbelievable at blocking glucose and glutamine from a cancer perspective, right? Having an IV formulation so that the absorption is a non-issue. But what if we're throwing the baby out with the bathwater by doing that, and we're actually inhibiting some of its effectiveness by not allowing it to get into the colon, into the microbiome, interacting with that to create a secondary response? And what if that is the primary response in some cases? Are we missing the boat? So I don't know. I think it's to be determined about forms of different things and absorption of different things. I think probably a liposomal or at least one with piperine, excuse me, would be good. What's the best place to get GS supplement that are ethanol extracted? Yeah, I have to look myself. And you'd have to. This is where the consumer. So this is part of taking responsibility for your health, right? Like, as much as I'd love to give you every single answer, I don't have all the answers. So I'm just trying to give what I got, and so therefore, like, it's going to take some effort on your part, probably to like look and see, and maybe even like question the manufacturer. Like, is this extracted via ethanol, methanol, water? Water extracted. Should I combine like an ethanol and water extracted herb to get like a secondary benefits? I think that I've seen herbalists where they do see benefits of both a water extract and an alcohol extract, and maybe the combination of those two have even like a synergistic effect, right? So I think that it would behoove you to look at the supplements themselves and see, what their extraction type is. I don't have one off the top of my head for this particular supplement. Let's see here. Yeah. So the reason for that, so someone asked me, I don't see a specific Gynemna supplement in your full script listing. The reason is the one that I have available is basically kind of like some basics of metabolic therapy, right? And so I don't consider that a basic of metabolic therapy. I consider that an adjunct to a person who needs assistance with glucose in particular, right? People's programs may look different depending on what they're struggling with, right? If they've got their glucose ketone index at 1, then they don't need extra support maybe with some of these things, right? Whereas someone who's a pre-diabetic, diabetic, or insulin dependent diabetic, they're going to need a lot of these kind of compounds potentially, like as a kind of a first line treatment to get their blood glucose down, their GKI down before you start employing other therapies, because unfortunately a lot of the other therapies depend on you having a good GKI. So therefore, why would we waste our time on some of the other things that can be quite pricey and difficult to obtain when your blood glucose is out of control, right? So it's not a one size fits all, and that's what I would say with that. Are there things that can interfere with the action of GS and supplement that we would want to avoid? Yeah, so I'd have to probably look at that. So what I would say is that sometimes supplements are better absorbed with food and fat, right? And some of them are absorbed better on an empty stomach. And so we have to look at, for example, for each one of these things, what's best at. So that's probably the only thing I can think of that would interfere with it. Maybe it doesn't have maximal effect because you're not taking it correctly. Or, probably more importantly than that, honestly, is dosage. Dosage, a lot of times when you'll see, one of the reasons I have a problem with a lot of the blood sugar support supplements that come from companies that are probably well-meaning, is that they have the right stuff in it, but they don't have enough. And the reason probably why they don't have enough is probably they're trying to save on cost, number one. But number two, they're probably also trying to stuff as many things into a smaller pill, so that way you're not taking 10 pills, right? And so it's going to be like, oh, this serving size has all this stuff in it. It's 2 pills. I only take 2 pills per day, but it's like you're not getting therapeutic dosages of anything in that bottle. So therefore, are you really helping yourself? So my point is that that's kind of the issue is probably the timing of it, but also the dosages. Are you getting the therapeutic dosages? So let's finish up today on cardamom, and this paper is titled "The Effects of Green Cardamom Supplementation on Serum Levels of Highly Sensitive C-reactive Protein, or hsCRP, Dimethylarginine, nitric oxide, blood pressure, and in patients with type 2 diabetes mellitus," a randomized, double-blind, placebo-controlled trial, and which published in 2022. And the reason I stole this the reason I put this headline is not because the paper was all that fantastic, but it had this pretty cool graphic, right, that I wanted to cite. And so cardamom blocks insulin resistance, which can inhibit nitric oxide, which can inhibit our blood pressure from being normalized, right? Cardamom can also stimulate some of the sirtuin systems, and the sirtuin systems, as when they're inhibited, can be a cause of pseudohypoxia and stabilize hypoxia factor and lead to Warburg metabolism. Sirtuins are probably a lecture series on their own of all the things they can do and what they do. But they do have effects and anti-inflammatory effects, which is how it affects the highly sensitive C-reactive protein, or the hsCRP. So multiple effects by cardamom. And that also is kind of furthered by this particular paper that was published in September of 2024. And it says here that cardamom has demonstrated to offer numerous benefits, including antioxidant, antimicrobial, anti-inflammatory, and other metabolic, anti-diabetic properties, and its potential to reduce cancer risk. Recently, researchers have extracted and tested multiple phytochemicals from cardamom to assess their potential effectiveness against various human cancers or malignancy. These studies have indicated that cardamom can overcome drug resistance to standard chemotherapy and protect against chemotherapy-induced toxicity due to its scavenging properties. Furthermore, chemical compounds in cardamom, including limonene, cymene, pinene, linalool, borneol, cardamonin, indole-3-carbinol, and diindole methylene, primarily target programmed cell death lignin 1 gene, which is more prevalent in cancer cells and healthy cells. So again, this is just kind of setting up, showing the kind of pleiotropic effects of one particular plant and all of its, again, it'll have a variety of flavonoids and other chemicals that are in these plants that have beneficial effects against a variety of diseases, right? So it's talking about coughs and colds, hemorrhoids, indigestion, diuretics, asthma, laxatives, headaches. It's going to have all kinds of different cancers like melanoma, pancreatic, ovarian, prostate, breast, skin, colon cancers, improving blood circulation, enhancing digestion, normalizing blood sugar, refreshing your breath, if that wasn't enough. So all kinds of cool effects, like as a whole, from cardamom. And then it kind of gets down into the kind of nitty gritty of molecular mechanisms, right? So it has anti-inflammatory effects, and it's showing variety of cytokines such as tumor necrosis factor alpha, IL-1, IL-6, NF-kappa B, or nuclear factor kappa beta, as well as STAT1, having effects on those. And then it's going to have antimicrobial effects, viruses, bacteria, etc. And then it's going to have pro-apoptotic effects within cancer. It's going to, interestingly enough, again, it's very fascinating. You see here, it has effects on sirtuins, for example, and that's going to have effects on the antioxidant response. It even says in the second paper that it has, where was it? It has protects against chemotherapy-induced toxicities due to its scavenging properties. What does that mean? It means it's an antioxidant, right, for the normal cells. But when we look at cancer cells, what does it do? It blocks NRF2. NRF2 is one of the most important antioxidant response element genes, and those NRF2 will help protect against ROS, which means that it makes cancer cells more resistant to ROS. Therefore, cardamom has an opposite effect within cancer, and it actually blocks that, so it allows sensitivity to ROS. In addition to that, again, I wasn't planning on talking about this particular important factor for cardamom, but why not talk about it since we got the graphic right in front of us, right? It also blocks hypoxia-inducible factor 1 alpha, one of the key effects or key messengers, and kind of activating the entire metabolic reprogramming and Warburg metabolism, having more kind of direct pathway effects on cell cycle inhibition within cancer cells, as well as inducing the caspase system and the various mechanisms of inducing apoptosis or programmed cell death within cancer. So just an unbelievable compound. Again, it's hard to really encapsulate, no pun intended, all the amazing things we have at our disposal. Just in probably most of our cupboards have cardamom, right? All right, so this is a paper published in 2022 titled "Effects of Cardamom Supplementation on a Number of Metabolic Factors: A Systemic Review and Meta-Analysis." And it says here that the fasting blood sugar was significantly decreased, as well as fasting insulin, but the A1C, again, what I want to try to focus on here, was dropped by 0.48%. Okay, pretty unbelievable. 0.48% from one particular spice. As it says here, cardamom is known as the queen of spice, seems to be an anti-diabetic agent due to its polyphenolic compound or contents. And again, just cardamom by itself can lower your A1C by 0.48%, which is pretty profound from such a simple, cheap, readily available spice. And it just to kind of dig into this a little bit, it says that there were 6 publications totaling 418 patients that were part of this meta-analysis. And it says here that they were taking 3 grams or 3,000 milligrams of supplementation of cardamom for 8 weeks to 3 months to have these effects. Okay, so it's not a short game for some of these flavonoids and some of these minerals and vitamins. You have to be on them for 3 to 6 months for it to have its kind of maximal effects on some of these things. So you got to be patient with the process. And again, it's not like you're going to be taking cardamom by itself. You're going to be taking cardamom plus exercise, plus red light therapy and sun and all kinds of other stuff, plus all kinds of other things we're going to be talking about as being part of your tool bag. But at least one of the reasons why I think medicine is good by testing these things in a vacuum is to get the proof of concept, as well as its kind of its unique properties against these particular outcomes we're looking for. But then again, the next thing that I think we should be doing is taking cardamom and adding it to, let's say, curcumin, and adding that to gymnema, and then adding that to other polyphenolic compounds and flavonoids as a way to get a synergistic effect. And that's what I would like to be studied next, is once we understand that there's significant lowering effects of these particular compounds, let's do them in combination and see if we can find that we need maybe lower doses when they worked in synergy. We just don't know because they're not studied like that, and that's a shame, unfortunately. Hopefully that will change when we start having kind of different leadership within the HHS in the coming future. Let's see if I can take a look at some of these things that people are asking. Apple cider vinegar would be another option instead of ethanol. Yeah, I mean, I've never seen. I'll be honest with you, and I'm not an herbalist, so I can't say that I'm like a definitive source on this. But I've used enough herbs personally, and I've looked at it enough and prescribed enough to, what would I say, to know enough to be dangerous, But I've never seen anything be extracted using apple cider vinegar. Does that mean it can't be used? I don't know. There could be properties of ethanol or just alcohols in general, right? And that's why there's other ones that use methanol that can extract some of these compounds. Cooked into a paste, organic turmeric powder, 3 teaspoons of piperine. It works. Thanks, doctor. You're welcome. So start drinking Turkish coffee. I don't know what Turkish coffee is. I'm guessing it has some of these things in it. But if it has these things in it, I'm sure that it's probably beneficial. Apple cider vinegar will not extract as ethanol. Any benefit of apple cider vinegar for glucose metabolism? It's definitely anecdotally used for glucose metabolism. Apple cider vinegar. I have not studied it, but it will. I'll look into it. We'd also want to see also if apple cider vinegar affects your glucose ketone index. Just, I kind of worry about things like that, maybe affecting your glucose ketone index, but it also may be misplaced worry. Are oxidative treatments effective when GKI is less or is 1, but average blood glucose remains around 100? Yeah, that's a great question, Stephen. So if you were to listen to Seafried talk, as long as your GKI is good, you're good. If you dig into his papers, in particular, the most recent paper published last month by him, Daraj et al., they do recommend your blood glucose to be on average less than 90. And I've been trying to beat this drum for a while after talking to someone really influential in the space. And they've told me that they really need to be less than 80 on average. So, yeah, I would say that your GKI being 1, but average blood glucose being around 100 is probably not ideal. You're on the right track, but you're probably not ideal. You probably need to work harder on the blood glucose side of things, which will even make your GKI even less than 1. And then Dr. Chef Peevler, no, trust me, I'm not Dr. Chef Peevler. You do not want me in a kitchen. I can make a main smoothie. I'm not bad at that. So if we're able to eradicate all these diseases, and you won't need Dr. Peevler anymore, Smoothie Chef Peevler could be a reality. It just may be a while before we get to that point because we have a long ways to go. So I'm going to cut it off. It's been about an hour, 56 minutes to be exact. And I think that I have a lot more to share in terms of flavonoids. So no need to fret about that. We'll start the next one off talking about, I believe we're talking about garlic. And there'll be a whole host of other flavonoids that you will recognize in the next one as well. And then we'll go on to other things. And I will make a note to look into apple cider vinegar, and I will make a note to look into Turkish coffee. And I actually want to look at, there's some other flavonoids and other chemicals that I have not yet put into the slide set that I want to make sure are put in there, just because I have a feeling they're going to have effects on blood glucose and insulin and A1C that are going to help us in our endeavors, and that may dovetail beautifully into metabolic therapy as a whole. So you're not having to do 2 separate programs, like a blood sugar lowering program and a metabolic therapy program. So if you like videos like this, please like, share, and subscribe. And until next time. And before I go, I'm going to answer this one question. Ozempic induced below 90s, any good? Look, I'm not a huge fan of Ozempic. I don't think that I recommend it for almost anybody. If you cannot get your blood glucose less than 80, except for by taking Ozempic, you've exhausted every other possible way of doing it, which I highly doubt, because there's a lot of things we can do. I would say that then I would say for a period of time for a very specific goal, then it would be probably satisfactory. But again, it's always a discussion between you and your doctor who's prescribing that. All right, until next time.